Could you tell us a little bit about APT and its work on OPCAT?
Yeah, Association for the Prevention of Torture, international Swiss NGO, working globally, essentially working with states and other national actors on how to reduce the risk of torture and ill treatment, and OPCAT is our best mechanism to do that. We're the organisation that was behind the drafting of the OPCAT, working with states, originally Switzerland and Costa Rica, but working with all states to get it approved, General Assembly, and now our big job is helping states and national preventive mechanisms in the implementation.
And in a nutshell, why is OPCAT important?
OPCAT's important because it's very much focused on preventing abuses in places where people are deprived their liberty. It's dealing with a problem that the world has had for centuries, people being abused and sometimes tortured and certainly ill-treated. And with the OPCAT, we've come up with a new approach, which is to say we can prevent this, and there are ways of preventing it by taking measures to change the way in which people are doing either interrogation, if it's in the case of police, or changing the way in which people are treated when they're admitted to the prison, or changing the way in which people are treated if they're in psychiatric or children's care centres, etc. But it's all with a preventive approach of like looking at what the root causes are of these abuses that take place behind closed doors, and coming up with solutions and saying, okay, we've seen that, this is what we recommend that you do, change your practice, change your policy, and you'll see reduction in problems where people are detained. And it's very kind of solutions orientated. It's a great way of making sure that everybody in all societies have their rights, that their rights are respected. And it's quite different to the way in which human rights have been promoted and protected in the past. Instead of being an adversarial one of, I have my rights and I protect them, I take them to court, etc., blah, blah, blah. This is more upstream, saying, okay, what can we do to reduce the problem, with the possibilities of possible abuse. So it's novel, it's also global, and that's, I think, particularly interesting for Australia, that if they do ratify the OPCAT, there's a possibility to share experiences in Australia with other countries. So in the period of 10 years, we've seen a real transformation of the global approach to torture and ill treatment, where a lot of governments are admitting that it's a common challenge. Not because of torture and ill treatment taking place, but more because there is in every country in the world, there is a risk factor of people being abused. And so how do you deal with that in a smart way? And that's what the OPCAT really is providing the world.
The optional protocol has now been operating for about 10 years. So what do you think, what's the progress in that 10 years? What are some of the key achievements?
Well, I think it's interesting to hear what people at the national level say, rather than just what APT says. And recently we organised a meeting of national preventive mechanisms, and they were surprising us with things that have changed. For example, in the case of Albania, the Albanian NPM said that because of their work, they've changed the whole culture about how people are treated in detention. And it's not just how the police work and how the prisons work, but also how the judiciary work. What's the role of the judges in terms of overseeing what they do? What's the role of prosecutors, public prosecutors? Also, what's the role of parliamentarians, in checking and making sure that things are being done right? And in that whole process, what they said that has been an enormous change is a change of culture, a change of attitude to the way which people are treated in detention, to say this is relevant to our society and to the future of our society, how we treat people in detention. And that's an enormous change that they've been able to witness compared to the situation before, where it was essentially a culture of lock them up and throw away the key.
So what do you think are the key lessons for a country like Australia as it gets close to ratification from the experience to date?
You are a decentralized country, and therefore important to get a coherent approach, get some good coordination going, but also to appreciate that this is not just a problem of prisons or care homes. It's a combined effort that needs to be made by a variety of institutions, including the judiciary, and including politicians and parliament as well. This is really, it requires a national solution to issues which are solvable. And the big plus for Australia is in terms of getting people's confidence back into Australian institutions, especially institutions which are taking care of people, institutions where people are locked up, for people to feel they're safe, they're in safe hands. And I think that's the big plus about the OPCAT. It's going to increase confidence in the state's ability to deal correctly with people who do need to be, in one way or another, taken under their control. Yeah?
And often a main benefit of OPCAT that's often talked about is this mechanism for a positive and a constructive dialogue to occur, so that problems can be addressed before they arise, or before they escalate, where they have arisen. And how do you think has this benefit been realised over the first 10 years?
Thanks for raising that, because it is a very constructive approach, one of entering into discussion, dialogue, for example, with the police, and saying, okay, what are the challenges you have as police officers? When the OPCAT isn't anti-police, it's how do we help the police do their job? It's a difficult job to do as well. What are the ways in which we can enter into a cooperation with the police to find out what solutions are to change it? But it needs to be across the board, and the police need to feel that all the other institutions are taking this seriously, and they're also engaged in an agenda for change and reform as well. And that's what the OPCAT brings. No? So, you asked me for some examples, and I thought of some that might be of interest to you. For example, in the case of Estonia, the Estonian NPM has made recommendations on children's centres, which has improved the conditions and the way in which children, adolescents are treated in detention. Same for Uruguay as well, also on that focus. Or you could look at a country like nearby to Australia, like New Zealand, where the New Zealand National Preventive Mechanism has had access to places of detention they didn't have before. No institution had access to, for example, psychiatric care centres. And because of the OPCAT, ratification of the OPCAT, the Ombudsman was given that power, and the Ombudsman was able to detect certain abuses that were taking place. Examples where the National Preventive Mechanism, OPCAT, has led to real change in the way in which people are being treated in detention. So I would have thought it's a win-win situation for Australia in terms of helping Australia move forward with, as I said before, making good use of the knowledge that already exists. But one of the pluses about OPCAT is that you can bring in expertise who may not have necessarily been used up to now. For example, psychiatrists, or anthropologists, or sometimes, or doctors, or ex-police officers as well. You can bring them into the equation to help you find the solutions to ongoing problems. And as one of your questions referred to earlier on, this is why it's such a constructive approach, such a collaborative approach.
I understand in the New Zealand situation that a number of the bodies have all indicated they have common issues around seclusion and restraint, and when to use them and when to not, so that the NPM at the moment is bringing all these interests together to work through that with guidance. So is that a sort of common approach?
Yeah, in the few countries where they've brought together existing institutions to create the NPM, we've heard that it's helped them have a common approach to problems related to seclusion and security issues, or particular groups who might have certain vulnerabilities. And in the case of New Zealand, treatment of the Maori and developing common understanding between the existing bodies on some coherent approaches to prevent abuses. So they found that it's been really helpful to have that cooperation between the existing institutions, B, to understand the divisions of labour better, because they're being brought together. They have to meet together and work out how they do and do their reports and recommendations, etc. So it's been a plus for them, and it's in a way it's strengthened the existing institutions and created a much better understanding between those institutions about what they can do, but also what they can propose to bring about change. And in any country in the world, bringing about change of policy and practice, it's very rare that can be achieved by one particular actor. You need a combination of national actors to bring about change and reform. And that's another beauty about the OPCAT, that it lends itself to collaboration between bodies to find the solutions that are necessary, and sometimes that might require change of government policy or change of particular practice, and that may have budgetary implications, it may have policy implications, it may have legal implications. And that's very tough for one institution to try and pull through that reform. You need the cooperation of parliamentarians, etc., Ministry of Justice, legal drafters, and so. That's why I think this is a game changer in terms of bringing together the people to focus on issues that require their common attention.
And the other element of the OPCAT is the Subcommittee on the Prevention of Torture at the international level. How in practice has that relationship between the SPT and national mechanisms worked?
Right. So they cooperate with all the states parties around the world. It's very much to enter into cooperation with the state and with the national preventive mechanism, and to give advice and support to what's being done at the national level. But the bulk of the work needs to be done by the national preventive mechanism, in the case of Australia, by Australian experts or experts based in Australia. The other role of the SPT is to provide guidance. So they meet here regularly in Geneva, and they can provide guidance on all sorts of issues to national preventive mechanisms. And so they understand there's a certain limitation to actually how much work they can do at the national level, and so they're very much delegating that responsibility to the national preventive mechanisms.
And independence and transparency are critical for national mechanisms in their operation, for credibility, among other things. But what are some of the better practice examples you've seen in the first 10 years? It's very important, this issue of independence and expertise and competence, and which is why we normally say that you need to get the mandate and the powers of the national preventive mechanism worked out at an early stage, including their ability to have sufficient resources, because it is quite a labour-intensive job, to do visits and to do preventive visits as well, which might take a few days depending on the size of the institution, etc. So it does cost money, and the national preventive mechanism needs that kind of ring-fenced budget to be able to do their work. In the case of Australia, I haven't done a budget estimate of what it would take, but you would need to work that out at the beginning. But what's really important is to ensure that national preventive mechanism has got the power of access to all places where people deprive their liberty, and that they also have access to individual persons deprived of liberty, and to be able to interview them in private. So there's certain things that could be put into a legislation at the time of ratification to ensure that the national preventive mechanism has got those kind of powers. And you ask for good examples. Well, I'd say probably the case of France is maybe the one that comes to mind, where they've got a very clear budget, they've got a clear role about what they're meant to do. They don't have anybody questioning their ability to go and visit a place of detention. It's all understood. It's well publicised, their work. And the big benefit of that is then that the work of the NPM is well known, and they can have an input into public debates as well, which is another plus about the OPCAT. What are some of the capacity issues that are commonly experienced by newly established national mechanisms? It
depends if it's a new institution or existing institution. If it's an existing institution, it's one of the capacity things is changing their methodology. To do preventive visits is quite different to going into take up a particular case of somebody who claims that they have been ill-treated. A preventive approach requires a different type of training. That's something which APT provides, that kind of training, but there are probably other institutions as well who could help out as well. That would also apply for a new institution as well, that they need that kind of support on creating teams which have a certain expertise in order to be able to analyse what the problems are. But the big benefit now of so many national preventive mechanisms, and I think it's up to 64 national preventive mechanisms of the 83 states parties, is that many of those national preventive mechanisms can support the new ones, no? And they can give their share their experiences, if necessary, give training as well. And we've been able to organise that type of exchanges between national preventive mechanisms, which have really benefited the new or existing institutions who've been given a new mandate.
Yeah, has the understanding of a sort of a human rights framework been a particular challenge?
Sometimes yes, but not necessarily so. In the case of Australia, there's not like a sudden enormous requirement of an enormous change, but there is a requirement to change the certain practices and policies, etc. That's for sure. I mean, there will definitely have to be reforms. There'll have to be changes, as we've seen in other countries, but they're not. It's reforms that are perfectly doable. But what this does is it creates a certain understanding of why there needs to be that type of change, and in that way you can generate the political will to bring about reforms that benefit everybody.
And a few sort of practical questions going forward for Australia. A common comment we hear is that OPCAT can appear a bit overwhelming at first, that when it covers all the places of detention. And what are your thoughts on how states can go about the task? So, for example, should they start with some sort of core areas like prisons, police lockups, juvenile facilities, etc.? Ensure that there's a sort of a baseline across all facilities. Should they take a thematic approach? What are some of the practical ways you can overcome this sort of anxiety that from day one of OPCAT you must be OPCAT compliant on everything, which may not be feasible or possible?
Whichever theme or institution you choose, you use that as a model, and you say, okay, we visited this particular type of institution, and with our preventive mandate, these are the kind of recommendations that we've made. And you publicise that, and in that way you start building up maybe a snowball effect or a ricochet effect of people appreciating that this new institution exists, and sooner or later they will be going to other places where people are deprived of their liberty. But that's why I said earlier on, the mandate is really important, to make sure that there's a very clear, strong mandate of what the National Preventive Mechanism is expected to do and what their powers are. But that it's not something that people should be frightened of, but more they can welcome it as something that's going to contribute and assist them in going about their work. No? So I think in that way, the national preventive mechanisms, whether it's at state and territory level or whether it's at the federal level, you can be quite free on choosing which type of institution, which theme, etc. But make sure it's public. Make sure you show everybody that you're active. No? I really like the story of the French NPM, head of the French NPM, when his mandate was passed. His mandate was passed, but the budget didn't still come through, and so he couldn't employ the staff. So he had a couple of months where he was on his own. So he bought a metro ticket, which cost a few francs or whatever, not very much, $1 or so, and he went off to a police station, and he visited the police station and explained what his mandate was, and did a press interview afterwards and said, this is what I'm doing. And the press suddenly kind of woke up and said, wow, this is really interesting. But it was also a way to speed up the whole process of getting the budget sorted out. I think what's important is publicize your work and show why it's different. Show that it's this constructive, cooperative approach, trying to find solutions, etc.
And so in a federated country like Australia as well, what do you think we should have as expectations for, say, the first 12 months that a national mechanism's in place?
I would say you probably want to address some of the issues that you decide of major concern and of major public concern. And I don't want to pronounce on that because it's up to you to decide on it. And show how you engage with the relevant authorities and also the other people that have some impact on that particular authority, whether it's at state or territory level or whether it's the federal level. And show that you can make recommendations and you can do follow-up as well, so that you can see some change in that particular issue or that particular territory or state. You probably want to give special attention to adolescent care centres because of the scandal that arose in Northern Territories, no? But the National Preventive Mechanism may have a different opinion on that. But that's out there in the public. So I think it would be smart if the National Preventive Mechanism could show how it responds to that particular crisis.
And as it matures as a mechanism, say 5 years down the pathway, would there be different expectations as to the level of work and how it's operating?
I think, you'd need to be able to show good coordination and coherence between the various state territories, work done at the local level with work done at the federal level. I think that's really important. I think bringing in expertise, new expertise, would also be an important landmark, if you put it that way. I think being able to show that you've got the authorities responsible for institutions coming out with statements saying that they welcome the work of the National Preventive Mechanism would also be showing positive impact as well. You might not get that reaction initially because they may feel kind of a little bit of intrusion in their work, but once they start seeing how recommendations can bring changes in their budget or changes in their human resources or how their people are trained, etc., but also what the view of the general public is to the way in which they do their work. That's what's going to be the big change. Probably one of the most important benefits over 5 years will be a shift in public opinion about how they feel people are being treated when they're deprived of liberty. And I think that's where the National Preventive Mechanism in 5 years can have some coherence across states and territories on a whole array of issues and a whole array of persons who have particular vulnerabilities in detention, whether they're poor or they're foreign or they're adolescents who may not be very well educated, or migrants, or particular groups such as women, children, LGBTI, or anybody who may be the source of some discrimination. That's going to be a real test to see how different they're being treated in 5 years' time. And that's what we've seen in other countries, that those persons who feel particularly vulnerable when they're deprived of liberty can now feel that their vulnerabilities are recognised by national preventive mechanisms, and in that way also recognised by state institutions. And then you get, a far more just system.
And Mark, you've got a captive room of officials from all Australian governments watching this. So what advice would you give them as they're about to embark on ratification?
Well, I think the major advice I'd give is that this would enable Australia to be part of a global solution to the way in which people are deprived of their liberty. We're seeing across all regions of the world, whether it's north, south, east, west. States are coming on board and saying, yes, we like this approach. We like the preventive approach. To the north of Australia, Indonesia is seriously looking at ratification. Further north, Philippines already have. Going to the south, New Zealand have already ratified. You're going further west and east. You've got most of Latin America has ratified the optional protocol. So I would say you can work this out, Australia, and I'm sure that you will all benefit, and you will benefit from a global expertise. But in the end, you're going to mobilize national expertise to resolve national problems. So don't see this as UN interference, because it's not really. The UN is just giving you the general plan about what you ought to do. But in the end, the solutions are going to be found by Australian experts. But the OPCAT enables you to bring in that expertise to resolve these issues. So go for it.